Hi, my name is Jessianna Saville. I'm a renal dietitian here at Kidney Nutrition Institute. Welcome to our mini classes to help clarify some common confusion. You might be joining us from YouTube or you might be joining us from our membership platform, but we welcome you here. We approach kidney disease in a way that we know is positive, and we want to approach it from a very common sense perspective so that we bring the best science, but also how you actually apply it. We've worked with hundreds of patients, so we have some great ways to actually apply the information and sort through some of the confusion that's out there. So really excited to have you here. We're going to go ahead and dig into this mini topic about protein and getting the right balance. Now we have multiple videos on protein. For this one, we're just going to talk about too much, too little. How do you get to the right amount for you? Is lower better? Now it's very, very common in kidney disease that you hear eat low protein, eat low protein, eat low protein. There has been a couple books written about very low protein diets and keto analogs. Here's what the guidelines say. Now, the most recent guidelines coming from KDIGO, which is an international organization, they recommend about 0.8 grams per kilogram, which is a really good place to start. For people that have much less kidney function and they're aiming for a very low protein diet, you're going to need to have a keto analog or an amino acid supplement with your approach. It's very, very hard to get all the amino acids when you get your protein much, much lower than 0.8. Some good studies on that. If you have too much protein, so if you have a very high protein intake, 1.3 grams per kilogram, we see this with bodybuilders, we see it sometimes in very proactive women that are trying to slow osteoporosis or postmenopausal, they'll have these very high protein intakes. It's highly promoted right now in social media and online. In that case, that can really drive kidney disease. You want to avoid excessive amounts as well. This very low protein diet, 0.3 to 0.4, can work great for some people. We consider it a temporary therapeutic treatment. If you want to follow this approach, highly recommend you do it with a professional and make sure that you have keto analogs in place, or there is risk definitely of some malnutrition with it. And those are some things to think about with this core kind of lower protein amount. So 0.8 grams per kilogram is the amount that you're looking for. This is something a dietitian can calculate and then format it into what that means for food. How much meat can you actually eat? It is hard to do 0.8 grams per kilogram if you're having eggs at breakfast and, like a meat sandwich at lunch, then normal like chicken or turkey or fish at dinner. You usually have to have a couple of your meals be plant-based to hit that. So are you getting enough protein? It is more common for us to see people getting too little protein than too much. What we notice a lot of times is people have diligently brought their protein down to help with the kidney disease. And after a few months of that, they start noticing slow wound healing, weaker, tired, reduced muscle mass, hair thinning, swelling. They get strong cravings sometimes for protein foods. Some people get anemic. For women especially, they are at risk for osteoporosis because you need that protein, among other things, to make sure that you keep your bone mass up. So those are a couple things to think about. If you have noticed after following a lower protein diet that you're starting to lose a lot of weight you don't want to, or if you notice that you're not as strong, or maybe you're having slower wound healing, that may be a sign that you need to either get a keto analog or more protein on board. So how do you optimize your protein intake? Honestly, because it is so specific to the person, right? A very, very active person might need a little bit more than someone who's very sedentary. It's really good to work with a dietitian on this. The dietitian not only can help you know how much protein to have, but what type. The other thing that we do with all our patients, highly recommended if you're working on your own, log your foods. We use Chronometer. That way you actually know how much you're eating. I can tell you 100 bajillion times I've had patients say, I thought I was getting enough protein, or I really thought I had brought it really low, but when I actually put it in, I can't tell. And then you need to adjust as needed from that. So a couple things. If you are not getting enough, you've logged it and you're like, way too little right now, there's a lot of ways that you can add it. You have nuts and seeds and seed butter. Some of the dairy products are sources of protein. Some people are totally vegan. They may not include these. We have patients that do. So it just depends. Eggs, fish or chicken, lentils or chickpeas or beans are good sources. Cottage cheese can be another good source as well. So there's lots of ways to get protein. If you are just eating vegetables and you don't want to include any sort of animal proteins, you must have some nuts or seeds, nutritional yeast, and maybe some of the soy products to get enough protein in. Common misconceptions here. Number one common misconception I see in this space with this protein intake is people say, if I have a lot of protein in my urine, it means I'm eating way too much protein. So if I'll cut the protein down in my diet, I will see less protein in my urine. That is not true. It is not a direct effect. A lot of times protein in the urine is due to inflammation. It's not so much due to just how much you're eating in general. That's a huge, huge piece. Sometimes people cut their protein down quite a bit and they're losing a lot of protein in their urine as well, and they can get some malnutrition or wasting from that. We regularly will use a keto analog or some sort of a kidney-designed protein supplement for people that are bringing their protein down really low or can't get enough. Another common misconception is you must be totally vegan, or that it doesn't matter if you have plant or animal. It goes both ways. We have a lot of patients that do very, very well being on a totally plant-based diet. It's a great way to learn how to modify your protein intake, get more plants in. But we have many patients that do very well also with a little bit of meat. That can be a very powerful tool. In our membership platform, we have a tool called Less Meat Meals. These are meals, the majority of them are plants, but they have a little bit of meat in them for people that want a little bit. Meat is very nutrient dense. For some people, can be a great add-in. We have seen over the last decade and working with hundreds of patients, again, you don't have to be 100% plant-based. You do need to have a lot of plants in your diet though, and not just grains, but the vegetables and fruits are very, very critical. So that's a really big thing that we see as well. So last piece, just tying this up, if you're joining us from YouTube, go ahead and subscribe below. If you're looking for a dietitian to assist you in getting a premium personal plan for you, you can click on our link at kidneynutritionist.org. If you are in our membership platform, again, reaching out to a dietitian to get some initial pieces in place can be another good option for you as well. Thank you so much for joining us. Check out some of our other short, quick videos on kidney disease. Drop any comments or questions down below, and we will try to respond as quickly as possible. We appreciate your time and your support. Bye-bye.